Welcome everybody to our next Security Buyer Live series session. My name is Rebecca Spain and I'm the managing editor here at the Security Buyer Portfolio. And this exclusive presentation today will focus on access control in healthcare applications. With increasing demands on overstretched staff, high-value assets to protect, and sensitive data to secure, traditional access control systems often fall short today. So Neil Foster, the Regional Director for Northern Europe for Integrated Control Technology, will walk you through how ICT's unified scalable solution addresses these pressures, offering seamless integration, real-time oversight, and advanced features like biometric access, emergency egress, lockdown protocols, and environmental monitoring. If you have any questions or you'd like to find out more, you can reach out to a member of the ICT team at ict.co or leave a message in the discussion box below. Over to you, Neil.
Hi, Rebecca. Thanks for that. Yeah, it's brilliant to be here to give you the opportunity to showcase what ICT can do in the healthcare environment. So healthcare is just one of the environments that ICT work in across the world. There's many different applications and different vertical market sectors that we work in. And some of the applications and problems that we talk about today, you'll actually see in other solutions such as data centers, financial institutes, college and universities, government, local authorities, for example. So with the healthcare environment, the staff that work in there are doing one of the most vital jobs imaginable, which is providing care for patients. The healthcare professionals need to be able to concentrate on their job, which is caring for patients, rather than looking at access control and security solutions and what their complex environment of the healthcare setting requires. So solutions in healthcare facilities need to be able to protect the staff, they need to be able to protect patients, visitors that are on site, as well as allowing speedy movement in critical situations. We understand it's been a challenging few years within the healthcare environment, especially with budget constraints and with COVID, for example. But within those environments where there's multiple entries, exits, restricted areas, you need an environment that's going to be able to protect the staff and the patients and the visitors, as well as any high-value equipment and medication or drugs that might be there as well. So in the healthcare facility, we need to accommodate patients who could be victims of violence, could be children or young adults, there could be individuals dealing with addiction problems, those with infectious diseases, or those facing mental health challenges. The staff that are working there are overworked and under-resourced typically, and the last thing that they need to be doing is grappling with disjointed security systems. They don't need the burden of an outdated security system that can't meet the current needs, never mind meet the future demands as a facility might expand. Along with protecting the staff and the patients, healthcare organisations, access control and security systems also need to protect critical information like patient records, hazardous materials that might be on site, drugs and pharmaceutical products, high-value equipment that's there, and also sensitive areas of the hospital as well. This is where ICT can come in and help with the healthcare facilities. ICT was founded back in 2003 by Rachel and Hayden Burr. With their experience that they gained in the Canadian market, they set up the business based entirely on the end user needs. So our headquarters is based out in New Zealand, but we've got sales, service and support teams that are located across the world. More than 20 years after we were founded, ICT products and systems are used every day in tens of thousands of companies worldwide. So with healthcare staff, administrators, boards and security teams, they require a system that's going to keep people, equipment, medication safe while streamlining operational requirements. The system needs to be customizable for their unique needs and scalable as the facility grows. So that's where ICT come in. Our healthcare solutions make protecting staff, patients, visitors and equipment really easy. We can give a complete overview and control of a unified access control and intrusion ecosystem. We've got the ability to scale with you, so it could be from one medical centre right the way through to a large hospital, or even multiple healthcare facilities dotted across a region. Our solution is fully customizable, allowing you to set up different access levels for different staff members, and then those different staff members can use one credential that can get them into multiple sites within that region. So when we're talking about streamlining operations, we need to make sure that the system is easy to operate for the end user. Ideally, we want the one platform that's going to give the access control and intrusion detection information, With ICT, we can also bring in the visual verification of who's just held the door open or who's forced a door. We can also bring in other sensor information like temperature, humidity, that might be particular areas that we want to monitor that information. We can bring that into a single operating system and a single interface to give you that oversight of the entire system. With ICT, we can also integrate into building management systems, for example, so we can control lighting and we can control air conditioning. The last thing that you need is lighting and air conditioning running in an environment that's not actually being used. So by integrating that with the access control, when somebody goes into that area, we'll switch the lighting on, switch the air conditioning on. It makes the whole building and the facility more energy efficient. When it comes down to the unified ecosystem, we can scale as the facility grows. So with ICT, there's no limit on the number of doors that you can have on the system. There's no limit on the number of readers or even the number of users. We grow with you. We're an open platform technology, so there's endless integration possibilities for a better business oversight of what's happening on that site. And we're truly future-proof. Again, it's unlimited doors, unlimited users. Your facility will never grow too big for ICT. The system also needs to be completely customizable. So we offer a great value on return of investment. We can fit with unique needs and environments. We can integrate with existing equipment that's there. We can build in features out of the box. So we can also do customizable systems to meet the needs of the customer. We can do customizable and automated reporting, for example. We've also got a series of integration tools within our toolkit. So we do a SOAP API that can be integrated into any third-party product that we don't actually have an integration with at this moment in time. And we also have nice tools like data sync, which will just bring in third-party information into the access control solution. So it's a solution that's tailored for you, and the possibilities are endless. So with the data sync that I've just mentioned, this is a really easy way of bringing information into the GX product. With data sync, if you've got an existing access control system, for example, which has got user information in, you're starting to expand your site and you're moving across to Protégé GX, the last thing you want to be doing is inputting data into two different platforms. With data sync, we can just export that information into a file or a folder from the other access control system, and then we can automatically synchronize that into GX. It just makes it really easy to have that single source of truth for the user information and bring that user information into GX. When you add that onto a GX server, it's just a one-off licensing cost that you add into the server, which is the ICT data sync service. So it just provides an easy, seamless transition of information from one platform across to Protégé GX. So there's quite a few features that we have within Protégé GX that help out within the healthcare environment. If you've got any secure areas or high security areas, we can have door interlocking. So door interlocking is just, we open one door, we walk into the airlock environment before we can open the second door. It just makes sure that if somebody's going into a drug storage area, for example, that somebody's not going to be rushing behind them, we can make sure it's a controlled access into that environment. We can also do anti-passback. So if you've got an environment, again, a high security environment where we want to make sure it's only certain personnel that are getting in there, I can use my credential to get in there. I can't then pass it back to somebody else who's then going to follow me in. It'll just deny access, or we'll create an event to let the security team know that somebody's tried to bypass the security. We can also do things like two-factor authentication. So rather than just using a card, which potentially could be lost, we can use things like card and a PIN number, or we can use card and then also things like biometrics as well. So the two-factor authentication just gives that higher level of security for those higher security areas. We can also have things like compliance check as well. So with compliance check, if it's, let's say, the pharmacy, for example, with the drugs, a general staff member can't get into that area unless the pharmacist's there. If the pharmacist is in there and a general staff member goes into that area, but the pharmacist leaves, we can create an exception report for the compliance check and let the security team know that there's potentially been a security issue there. There's other things that we can do within the healthcare environment. So we can set up what's called blue light corridors or emergency egress. So if you have an accident, an emergency, for example, where somebody comes in and has a heart attack and you need to call the crash team in, the last thing that they need to be doing is using the access control to get through those doors. So we can integrate the access control into a crash button, for example. So somebody hitting that button, we just unlock a series of doors that lead to that room. So we know that the crash team can be effective in getting through to that area and providing care at the soonest possible time. As soon as that crash button's reset, then the system will automatically lock those doors again. There's other things that we can do. So we do vandal-resistant covers for readers. Those will just protect the reader from impact, but it also can be used as anti-ligature cover as well. Other simple things like using user credentials. Everyone's familiar with cards or tags as a user credential. In the healthcare environment, one of the things that we can do is give them a wristband, which is an IP67 rated wristband. That just means that I'm very unlikely to, have a lanyard around my neck that's in the way as I'm trying to provide care for somebody. That credential's on my wrist. It's hard for me to lose that. It's always within reach and easy accessible, as well as if I'm working with patients and I need to keep my hands sterilized, then it's IP67, so we can actually wash that as well. So with the other features that we could do is the reverse of the emergency egress is lockdown. So lockdown can be useful where there's a situation occurs and you need to lock a series of doors. So it could be somebody's come into an accident and emergency department and the causing a scene. You need to call the security team, but you want to make sure no patient accidentally walks into that environment. So receptionist can hit a panic button, will lock a door, a group of doors, or the entire site. That just stops somebody accidentally walking into that area. People like the security team have an extra level of credentials, if you like, so they can actually bypass that lockdown to go and handle that situation, but we're just stopping the staff or the public accidentally walking into those areas. With the solution, we're designed to be completely customizable. So there's lots of different applications that we can do. We mentioned earlier on about bringing CCTV cameras in. So where you get a door forced open or a door held open and you want to know who's done that, it's quite easy for us to bring in CCTV images of products that could already be on site. Just to give the security team that verification, we can provide a pop-up that shows who's just forced a door open. We can also use other devices like biometrics. When I mentioned the two-factor authentication earlier on, biometrics readers is one of the things. It just takes it away from having a credential. You can just use your fingerprint or even your face as a verification for you to be able to gain access into that area. So one of the big things with ICT is how easy it is for us to migrate legacy products across to ICT. In a healthcare environment, legacy products are there. It could be that the legacy product doesn't provide the features that you want with the access control. It could be that product is becoming end of life. In the ideal world, we would just rip everything out and replace it. Obviously, with current customer budget constraints, that's not possible to do that. So ICT give you a nice phased migration path. A lot of solutions that we do, we're actually installing new ICT hardware onto an existing site. We can use that data sync service that I mentioned earlier on to synchronize the user information from the old access control to the new access control. But the other thing that we can do in a lot of situations is actually use existing cards that are out with the users, the existing credentials. They can be worked in conjunction with the ICT readers and the ICT hardware. That just means you can continue to expand the facility without having to go through the process of issuing out lots of new credentials to the end users. The next step on that migration path is you might have areas that are the higher security areas where you want the higher level of security. So, for example, the Desfire EV3 secure cards, or it might be that you need the compliance check in those areas. Again, we give you the nice facility of being able to use the ICT equipment. A lot of the times we can use existing readers that are on there and the existing credentials, but just give you more functionality with the ICT hardware and software that's behind the system. We can then start doing upgrades on site. So we do dual technology cards. So they've got low frequency for old systems and the higher frequency Desfire EV3 credentials. So you can start and use those on old readers as well as new readers that have been installed on a site. So we just have a real nice, easy migration path to move from legacy products into a new ICT hardware solution. So with the system, we're future-proofing for you. So as we've mentioned earlier on, there's no restraint on ICT hardware. We can go to an unlimited number of doors. We can go to an unlimited number of users. The system will never be outgrown by your facility. ICT will be able to cope with it. We also have cost-effective expansion options for future growth. So with ICT hardware, once you've bought 1,000 licenses that sit on a server, it then becomes unrestricted. You can just keep on adding more and more doors to that server. There's no more licensing costs. Again, if you're looking at CCTV cameras on there, once you get to the 500 camera licenses, then again, it becomes unrestricted. You can start adding as many cameras as you want. There's no more license costs. So it makes it really, really cost effective for the end user. A quick case study. So this is a hospital out in Reykjavik where we've actually done this process. So they started off with an access control system where the security staff didn't have a full overview of the site. There was lots of different buildings. So there's 100+ buildings on there that had an assortment of security systems that were out there. So it was ineffective security management and a lack of automation in the system. They've gone through the migration path of migrating across to ICT. That slide says 1,000+ access control doors, but that site's actually up to over 1,400 doors at this moment in time. There's 10,000 users that are on there and 100 buildings across 17 sites. With the Protégé GX platform, that's a unified access control and security solution that's monitoring all of those sites. So it's a significant decrease in security response times. The security team can see exactly what's happening on those sites. It's also given them a huge cost saving by automating building functionality as well. So we've integrated with things like the HR system for bringing in the end user information. We've integrated in the video management system for bringing in the CCTV images to show them what's happening with alarm activations there, and also bringing in lift and elevator control so we can do destination-based control on the lifts. So that's a very, very quick overview on what ICT can do for you. Thank you very much for your time. I hope it's been an enjoyable presentation. My contact details are on there if anyone wants to reach out and ask me any questions. I want to look at any operational requirements for any healthcare environments. And also the links on there to the website, which has got a massive amount of information on there, from application notes of what you can do with ICT, right the way through to the brochures and many more case studies. Thank you for your time.
Hi, Neil. Thank you so much for delivering a great presentation on the challenges and solutions in the healthcare sector. And just to expand a little more on some of your points that you highlighted, I have a couple of questions to go through. So firstly, you mentioned at the beginning of the presentation an API that can integrate solutions from manufacturers that aren't necessarily an integration partner of ICT. So I wondered if you could expand a little on this. It's a very interesting point in market at the moment. Is this an open API?
Yeah, so ICT, we've got a couple of open APIs, to be fair. So there's one for the GX platform itself. So that enables you to use it in conjunction with visitor management systems. So you can bring in user information, literally anything that you can do with the GX software, the API can do as well. So we have people use it for visitor management systems to be able to unlock doors. It could be that you've got a CCTV system that we don't integrate with, that you want that integration to work with. So the API just gives you a really easy way of writing that integration to unlock doors, arm and disarm areas, bring in CCTV integration or whatever you need to do with the solution. The other API that we actually have is based more on mobile credentials that we haven't mentioned so far. So we have our own mobile credentials, which are hosted in our mobile app, but we actually have an API that allows third parties to host that as well. So that's something within the healthcare environment. If they're looking to use more mobile credentials in their own app, they can actually host the functionality of an ICT mobile credential in that app rather than using our app.
Definitely. I mean, like you said, it goes further than integration. You're actually properly embodying interoperability, which is always a really good sign for manufacturing. It means that working together with other manufacturers enables that kind of innovation in industry. And just coming on to my next question in terms of one of the biggest challenges that I've seen in the healthcare sector is obviously hospitals operate continuously 24 hours of the day. And that makes downtime very, very difficult or unacceptable in certain circumstances. So can you describe how ICT ensures minimal disruption during this migration period that you described from perhaps a legacy system to a newer security platform?
Yeah, no problem. So it all comes down to the system integrator, to be fair, and the hardware that they're using. So if there's a migration from one system to the other system, inevitably there's going to be a time where that door is going to be disconnected as it's changed over. But it's really down to the system integrator to have the right operational requirement, the right planning in place. They can set the server up in the background. They can have the hardware all installed and ready to swap over. It's just literally that downtime of disconnecting that lock and connecting it to the new lock or the new controller, and then maybe disconnecting the readers and swapping them across. So there's always going to be a chance of some disruption. But again, working with the system integrator, that can be done out of hours where it's going to have minimal impact to the facility itself.
Definitely. And one of the other kind of complexities of a healthcare environment is where kind of security has to be balanced with accessibility. So how does ICT ensure that this balance is effectively achieved without compromising, I suppose, either aspect?
Yeah, well, with a unified solution, I didn't quite go into it in the presentation, but one of the things that makes it so simple is we're a unified access control and intrusion detection platform. So a lot of customers struggle with the concept of using access control and then managing that with intrusion detection as well. But that's something that the GX platform will actually do for you. So if I've got a credential that's an access control credential, but I'm not actually allowed to disarm that intrusion alarm system, I can actually be locked out of an area. When the staff member goes in that disarms the intruder alarm system and unlocks the door at the same time with exactly the same credential, that then enables me as a staff member to get in and out of that area. So with a true unified solution, there can be a lot going on behind the background that the end user's not actually aware of. And that comes into when you've got, areas that are low level with Windows. We can monitor the lock on an access control system, but usually an access control system is not actually monitoring a movement sensor within that room. But with ICT, it is a unified solution. So it's the access control and the intrusion that's in one. You disarm, you unlock the door, it's going to disarm the intruder for you.
Mhm. And we're seeing kind of unification and this demand for a unified solution becoming more and more apparent in the industry from the end user perspective. And do you think that we're no longer in industry just pigeonholing people into certain different criteria? You're either a CCTV, video surveillance solution manufacturer, or you're an access control. You seem to kind of be pushing down those boundaries. Tell us a little bit more about that.
Yeah, well, it really is. From an end user's point of view, you want everything in that one unified platform. So if I'm monitoring an access control solution and I might be setting up new users for that, I might be manually unlocking doors for people with the software. If there's an event that occurs where somebody forces a door open, or, last week somebody's used a credential in an area that they shouldn't be, you bring the CCTV into that, and one, it can give you a pop-up of an incident that's just happened now. So you've got the instant visual verification. But what we can also do with ICT is link that CCTV event to the event log. So if I want to see, a user went to an area that they're not allowed to be in last week, I can bring that up as an event within the access control. But then you can also right click on a camera icon and ask it to retrieve the video footage. That instantly then pops up with the video footage, so I can see exactly who tried that credential. So if that user's saying, "Oh no, it wasn't me. I lost my card at that time," but you've got the video evidence that it was them, it brings it all together, and that's what solutions should be doing these days. It's all about bringing everything together, even down to the extent of, if we want to sell the dream, as it were, I can give you a credential that'll unlock your door, it'll disarm your intruder alarm system. It'll then work with your building management system that we mentioned. So it'll switch your lights on, it'll switch your air conditioning on. I can then use it on an elevator or a lift, so I can go to destination-based control, so it knows I'm a staff member. I can go into the basement that the general public can't get to. It's all about just making that user experience really, really easy for them.
Definitely. And you're kind of moving from a reactive solution to a more of a proactive solution. And I think, as urbanization is growing rapidly, as we're seeing in cities all around the world, we're seeing that need for smarter buildings, smarter cities coming into play. And that's where that integration with building management system comes into play a little bit more as well. And just lastly, finally, I wanted to touch again on your kind of scalability and customization, because that's such a core demand from the end user. And I know you spoke about it in your presentation. But what are the key considerations hospitals should have in mind when planning a long-term security strategy, especially with kind of potential expansions of facilities or services, like you mentioned? but also how easy is it to customize different types of readers or systems dependent on that application? So, for example, in theatre.
Yeah. So with ICT, the Protege GX is an enterprise platform. You can start off with 2 doors, and you can virtually go to an unlimited number of doors. So the case study that was on there, 1,400 doors. We've got other projects within the UK where we're starting with 1,400 doors and access control and adding more and more all the time. So when you go for a platform like Protege GX, especially with the licensing model that we've put that license cap on at 1,000 doors, it really does make it cost effective for that end user to scale that system up, but not always constantly be having to pay for more and more licenses. When it comes to migrating a system across, you mentioned readers in there. So with ICT, we are open protocol. We work with a lot of different protocols on readers. We work with a lot of different card formats. So we can actually take on existing cards in a lot of times. So you don't have to give out those new credentials. We can work with existing readers. That gives the end user more bang for his buck. Not liking to use that terminology, but it does. It just means that they can actually keep on expanding the system, put the hardware in the background, keep the existing readers, keep the existing credentials. They might not be the most secure that's there, but they're providing a service that they've been familiar with. Sort out the back end solution, so they've got that scalability to build that functionality where they can bring in those additional services. And then as time goes on, they can do a migration path of updating the credentials and updating the readers. And then with functionality, a lot of customers like that lockdown that I mentioned in the presentation. A lot of customers would love that on their access control system, but they don't actually have that at this moment in time. Bringing in things like operating theatres. I mentioned data sync in the presentation. One of the things you can do with data sync, it'll just bring in user information, access levels. You can use that as a booking system, for example, to give people access to an operating theatre or a treatment room. And we also have other things like calendar actions. So if I want to have a reception door that's 9 to 5 and it's unlocked on a schedule, but then for some reason I'm going to be working out of hours and I want that schedule to be extended, rather than doing a manual override on that, or rather than messing around with that schedule, a calendar action is just a real nice, simple way of dropping in a calendar action to say, on Tuesday between 5 and 7, this door, leave it on free entry. And then people continue to come into a clinic that might be added on. Back in the days of COVID, that was happening all the time of people doing clinics on Saturdays, for example.
Definitely. And I think one of the kind of biggest points you mentioned there is it's when people are looking for solutions now, it's not just about what new technology can I integrate or how can I is it because my system's become to end of life and it's a necessity for me to get a new system, but it's about cost of procurement and cost of ownership.
Yeah.
Unfortunately, we live in, especially in a sector like healthcare, where budget constraints are so tight. So it's great to see manufacturers kind of rising to that challenge of providing the solution there and working with the end user. So thank you for that. And unfortunately, that's all we have time for. But Neil, thank you so much. As always, it's a pleasure to speak with you and have ICT's valuable insight, especially, like I said, in such an important environment. If anybody would like to find out more, please don't hesitate to reach out to Neil or the wider ICT team. Thank you.
Thank you.